Yes.
Shiva.
Okay. So a very good evening to all our participants on Zoom through Pavitra. And as I've always said, Pavitra brings to my mind nothing else but everything that's auspicious. Shuchit, Shuchita, Pavitrata. And therefore, we have had a variety of speakers on this platform giving us valuable inputs to change our lives in so many ways. Uh, I don't think Dimple is a very new name. She's already known to our participants and to so many people all over the world. I'll be very honest with you, Dimple. I got introduced to you by watching your previous recordings, which had happened in the sessions on Pavitra. And I was completely bowled over. I thought, here's a person who has a wealth of information and information that helps to heal. It's really required in these times, challenging times, where we are all surrounded by the virus. You gave me an insight into Ayurveda, which was for me nothing else but jari booties, some potions, concoctions. And after I heard you, it became something far more spiritual and philosophical. And I was eagerly looking forward to having this conversation with you. Now, to give a very brief introduction of Dimple, who's for me an institution, for many of us here, I would just say that she's now following her calling. She's been there and done that, has donned many hats, has been an accomplished professional, but now finally she's in a space where she can benefit this entire gamut of people around her, and who is, if I may use the word, Dhanvantari. And I was thinking about how much I know about Ayurveda, Dimple, and I thought, I just knew that it was something that was first time mentioned in the Atharva Veda. And our mythology, our religion, our scriptures said that from Brahma to the Ashwini Kumars and the recorded history to Dhanvantari. And finally, you are the torchbearer of this profound healthcare system. Welcome to Pavitra once again. And it's on a variety of topics that we are talking. Dimple, are you there? Dimple?
I think she'll join in, Shubha. You can continue.
So, to all our participants who are here, Dimple, founder of Prana, is an Ayurvedic health coach, gut and colon health expert, treating the body through Ayurveda and Panchakarma treatment. She started Prana in 2017 and devoted her time to research in Ayurvedic science and nutrition for preventive health care. This project was started with an attempt to bridge the gap between traditional Ayurvedic science and modern research-based science. The vision is to make Ayurveda a global phenomenon and a household practice by making it easier and simpler to practice on a daily basis. She has over 12 years of experience working in multiple industries, visual communication, international businesses, and several managerial awards. She began her career in advertising and moved on to become a TV reporter at News 9 and then a producer at CNBC TV 18. My God, at Rudra, she headed cross-border M&A transactions worth 500 million US dollars for leading Indian infra companies. And now you're here. What a journey. How's it been? Just to begin on a personal note.
They say you do an entire circus before you find your purpose. I think that's what happened in my case. Whenever I speak to my uncle about my journey, he says, sometimes my aunt says, what were you doing? How did you become an Ayurvedic health coach? How did you become a poop doctor? You're asking people questions about their poop and all now. You're not even qualified. What's going on? I said, yeah, I had to go through a whole circus for my soul to learn from pain that this is my journey. And you mentioned Dhanvantri. Only last year, when we were, releasing ads for Dhanteras, celebrating National Day of Ayurveda, we started researching and we found out that was the birth date of Dhanvantri. Dhanvantri arrived on earth on Dhanteras Day with a pot of gold, pot of golden colored ghee, 100-year-old golden colored ghee. And he said, this is your remedy for all maladies. Okay. And then we discovered last year that my birth date coincides with Dhanvantri. So I was like, okay, maybe this was my journey and purpose.
Oh my goodness, gives me goosebumps. Everything is preordained. It's his perfect design. And you are a perfect pattern in his design. It's so wonderful to have you here. We are going to cover a very vast topic, Dimple. And it's going to be gynecological health vis-a-vis PCOS, PCOD, UTI, infertility. And it could be so much more. But I just want you to very briefly tell us, how would you define gynecological health? And then we can go on to the specifics.
Like how you just said, everything is preordained, right? The reason being, our spiritual source of energy is preordained. We already come with a determined path of career, growth, personal life, professional life, and even a determined path for childbearing.
Determined
even
path
that's
for?
predetermined. Childbearing.
Oh.
Your ability to bear children
Yeah.
is a sum of your karmic activities.
Yes.
And it's mentioned in Bhagavad Gita, a man who has son has the ladder to heaven. Son or daughter, doesn't matter, right? Ability to give forth or give birth to a child is a huge blessing. And it empowers you and reminds you that women are such a powerful force of nature.
Shakti.
Shakti. A child is born in the womb of Mother Nature.
Yes.
In the lap of Mother Nature, in the womb of a woman.
Yes.
So this is Mother Nature. The uterus is literally the epitome of Mother Nature. When the uterus is not aligned to Mother Nature, when it's disconnected, when there is discommunication, miscommunication, or disconnect, or a gap, then it leads to all kinds of disorders, because your womb is literally Mother Nature sitting inside of you, right? That means if you're not living aligned to nature, if the estrogen in your body is not getting digested, if you're consuming the estrogen of another animal, it's going to create havoc inside your uterus. Gynecological health simply aligns to the rules of nature. In fact, if you look at a period cycle, the 28-day cycle, how is it that it's only 28 days and not 24 days or 19 days or 16 days? If it becomes 19 days or 16 days or 40 days, we have to run to a gynecologist and say that my period cycle is not correct, right? Why is it 28 days? Because the period cycle of a woman is directly aligned to the position of the moon. The moon, that's why it's called the moon cycle. So see how powerful it is and how much more relevant and important it is for a woman's body to be aligned to nature. When there is disalignment or disconnect, it leads to diseases.
Definitely. So in fact, Prakriti and a woman are one. She's the very embodiment of Prakriti. That's what you're saying, right? And coming to the specific topics that we are going to deal with, PCOS and PCOD, that's what the poster said. Now, even though I'm a mother of two daughters, I get confused. What's the difference between the two? Is there any difference between PCOS and PCOD?
There is definitely a difference. So I'm not a seasoned gynecologist. I am more an Ayurvedic health coach, but this is something I learned from our own gynecologist. And she, in fact, told me this powerful information. People don't know the difference between PCOD and PCOS. One is a polycystic ovarian disorder, and one is a polycystic ovarian syndrome. In one case, the eggs become too big. in one case, the eggs are not functioning
All right.
or malfunctioning. Okay, so there's a very definite difference between the two, but the source of imbalance in your uterus is the same. The reason being, your uterus is producing estrogen every day, but if you're not able to digest that estrogen, it leads to a whole lot of gynecological disorders. You can give it different labels, different names. It can be PCOD, PCOS, uterine infection, uterine bleeding, or delayed periods or infertility. It can be anything, but the source problem is the same. The uterus has a very definite role to produce estrogen. The eggs have to do a 28-day cycle. They have to keep moving. They wait for the sperm to be able to reproduce. And when the sperm doesn't arrive, they go back. And in the process, the lining of the fallopian tubes gets washed away in the form of blood outside the body. And then we call it impure blood and a lot of irrelevant, stereotypical stuff. The source of problems is the same. When I said you have to be aligned with nature, a woman's body is even more sensitive to disconnect with nature than a man's body. A man's body might show it a little more later, but a woman is more at risk of diseases like breast cancer, uterus cancer, vaginal cancer, and all kinds of cancer, like ovarian cancer.
The cervical cancer.
Cervical cancer. Women have more diseases aligned to them than men do.
Yeah.
Right? Simply because we have an extra rib, we have extra organs that is capable of reproducing an entire human being from scratch, an entire baby. You said the word Prakriti, right? Woman is same as Prakriti. In fact, the Prakriti, that is the individual biomedical signature that we have, is called Prakriti in Ayurveda. Each one of us have a unique Prakriti, right? The Prakriti is determined at the time of conceiving based on 4 factors: health of the egg, health of the sperm, health of the uterus, and the kind of diet that the mother follows during pregnancy. So you see, out of the 4 factors, 3 factors are controlled and governed by the woman.
Yeah.
Only 1 factor comes from the man. So the man's job is done after he's given the sperm in terms of reproduction. Of course, there are other moral and social obligations of taking care of the woman and being loving and kind, because 70% of the child's brain and personality develops in the womb based on the kind of relationship and the conversations the mother and father have. So the woman's role in reproducing is definitely far more powerful, of course, because she bears the child for 9 months, and then she feeds the child for 2 years, and then she raises the child and the whole family. A woman's role is powerful. And in fact, a woman is more at risk of diseases than a man, which means a woman should be aligned to nature more often than a man. Now, one of the biggest sources of gynecological disorders is the dairy products we're consuming. Okay. Where does milk come from? Milk comes from the cow, a goat, camel, buffalo, sheep, whatever the source of milk. I'm talking about animal-based milk, not vegan milk. Where does a mother's milk come from? From her body. Any milk that comes out of her body, a physical living creature, will also carry the DNA imprint of that person, that creature. Lots of times, when cows give milk in distress inside a factory, instead of a farm, where a machine is attached to the udder, they also release their emotions and their trauma. Their pus and blood gets released into the milk. And when a woman consumes this milk, she's consuming the trauma of another mother. She's consuming the estrogen of another creature when she's not able to digest her own estrogen. That leads to a whole lot of malfunctions in the uterus. So from the packaged milk that you get, packaged milk that has a shelf life of 6 months and 12 months and whatnot, a man might show results or negative impact after a few days or few weeks, but a woman will start reacting to it immediately. That's why 4 out of 7 women in India have PCOD or PCOS or uterus-related disorders. 4 out of 7 women. That's not a small number. Now the number is increasing in terms of breast cancer also. Fibrocystic or benign lumps. In fact, I have undergone 2 surgeries for benign lumps. And I never understood the source of my trauma or the reason why I had to end up in surgery again and again. After going through so many years of evolution, I realized it was my own mistake. My diet was wrong. I was eating estrogen. I was drinking soya milk. I was drinking, milk from an unhappy cow, which was causing havoc in my body, in my reproductive organs. That's rule number 1. A woman should not consume the trauma of another mother because it will definitely create a conflict in her own body. And see the coincidence. PCOD, PCOS suddenly went on the rise the same time as the milk or the white revolution happened in India. What is a white revolution? Suddenly, the milk production went up dramatically. Now, kudos to the people who decided to end starvation by increasing milk production. But in the process of artificially increasing production of milk, what did they do? It went through a commercialization process. They imported Jersey cows from Europe and they mixed it with the Indian Gir cows to reproduce milk, because a Jersey cow can give up to 32 to 50 to 60 liters of milk. And the Indian cow, the Gir cow, can give 10 to 12 liters maybe. They started importing Jersey cows in India, which has a European body and is suitable for the European topography and geographic condition. And then they started keeping the cows inside a factory instead of a farm, artificially inseminating it, making the uterus give birth every year instead of giving birth twice in a lifetime. What happens? The uterus of the cow is destroyed and damaged and ruptured. It's bleeding. It's got a whole lot of uterus-related diseases. The calf is separated from the mother. The mother goes through trauma and starts releasing pus and blood. And it's releasing estrogen and diseases into the milk. Drugs, steroids, antibiotics is injected into the cow. Even that is getting released in the milk. And that is being packaged in plastic covers, which then releases carcinogen, cancerous cells because of exposure to daylight. And then it's packaged in Tetra Paks, which is coated with estrogen. So what have we done? We've taken something from nature. We've completely destroyed nature in it through human intervention. And then we gave it to a mother, a woman to consume. And a whole lot of disorders from there.
Yeah. So what is happening, Dimple, now is that as my daughters were growing up, and I was talking to mothers, other mothers with the same age group of daughters, and PCOS and PCOD was a very common problem. I'm intrigued. As you said, as the white revolution came in, there was an increase in this kind of a problem. But how do you rectify it? How do we eliminate milk from our diet? You know, it has become a part of our psyche. It's like our second nature now. Doodh piyo, calcium kam ho jayega. You know, those are the taglines. Haddi kamzor ho jayengi. So how do you, I mean, get away from all this? Is veganism the only answer? What are the other changes in diet that you
Okay.
recommend?
I'm glad you asked that, because shifting lifestyles is painful. The transition process is always painful. And to be honest, I'm not a vegan. I'm only promoting a vegan diet for someone who's affected by PCOD and PCOS because the body is not able to digest the estrogen. If you have been diagnosed with any gynecological disorder, do not consume animal products, rule number 1. Animal products, again, has too much cortisol in it, which is linked to psoriasis eczema. Animal products like red meat and white meat and seafood has a lot of mercury levels and pollution. And if we have so many diseases, the animal also has a lot of diseases. So if you're already feeling symptoms of an early disease, you definitely must stop consuming diseases from other animals. Right? If human beings have so many diseases, animals have more diseases. Just that they don't have someone doing a consensus on their mortality rate. How many monkeys died? How many cows died? How many bats died? We don't have. The coronavirus existed in the animal kingdom and jumped to the human species. And now we're suffering. So animals have more diseases than human beings. They're eating plastic, they're eating this and that. Now, how do I replace milk in my diet? If you are diagnosed with any gynecological disorder, a good gynecologist, be it an allopath or a homeopath or an Ayurvedic doctor, will tell you, a good gynecologist doctor, the first thing they'll tell you is stop consuming all dairy products. Okay? If you don't want to get into the risk of having gynecological disorders, you can start replacing cow's milk or buffalo milk with coconut milk or almond milk. Now, I don't drink milk at all, but I need ghee in my diet. And I was trying to debate with myself, how can I have ghee in my diet if I'm not having milk? And then when I researched, I realized even people with lactose intolerance can consume ghee. It doesn't give intolerances. So even a person with PCOD and PCOS can consume ghee because ghee has been processed from milk by leaving the milk solids behind. And it has gone through multiple processes and it's a fermented product. So the milk has been converted into yogurt. The top part of the yogurt is a cream that has been allowed to ferment overnight. That cream has then been converted into butter. That butter has been converted into ghee. So it has gone through multiple processes, metabolic transformations to become ghee. So it has left the milk solids behind. It doesn't have the same impact as milk. So even if you're vegan, in fact, a lot of my vegan students have decided to include only ghee in their diet and stop everything else. They've actually started incorporating ghee after attending the classes because we said ghee is the only ingredient in Mother Nature that can pull heavy metals out of your body.
Okay.
Dhanvantri appeared with ghee 5,000 years ago on the day of Dhanteras. When he himself is saying this is a cure for all maladies, who am I to argue with him? He must have researched it for 10,000 years before arriving at that conclusion.
Yes. So, in fact,
Right?
that pot of yellow ghee is the real gold.
It is. That's why they say health is wealth, and we misunderstood it, and we're going out and buying gold on Dhanteras Day instead of buying ghee or Ayurvedic herbs and medicines for good health.
Okay.
Health is wealth. It has been misunderstood.
So, what I understand is that the entire process of making ghee makes it absolutely suitable for us, beneficial for us.
All
Now,
body types.
yeah.
Kapha,
Now,
Pitta, Vata, cancer patients, PCOD, PCOS patients, obese person, skinny person, everybody can have ghee in different proportions.
okay. Now, when I was listening to your earlier sessions, I thought you were talking about yoga also. So, is Ayurveda cum yoga a very good combination for beating something like PCOS and PCOD?
Definitely. Definitely. So in Ayurveda, we have a series of medications for uterus related disorders.
Okay.
Now, if you have PCOD, PCOS, the first thing we tell you to do is stop having dairy products like milk, yogurt, cheese, paneer, have only ghee. And once in a while, if you have digestion issues, have buttermilk. Again, buttermilk has been transformed from milk to yogurt to buttermilk. There's no fermentation process, the probiotics has been kept, and we've added so many spices to it to break down the complex microorganisms.
Okay.
So buttermilk is very good for all three doshas again, even if you have PCOD, PCOS. But initial stages, we'll tell you to stop everything except ghee. Have coconut milk, almond milk. Do not touch soya milk under any circumstance. That is dietary restrictions. Rule number 1. Soya milk has no digestive enzyme. It is made inside a factory. It's not made on a farm. We were born in the womb of Mother Nature, not inside a factory. So stop eating foods that were made in a factory, be it refined sugar, refined salt, refined oil, refined ghee, refined flour, refined soya milk, and tofu. Stop eating foods that were made in a factory. I'm human. Sometimes even I grab a bag of chips and I eat it. And I know it's made in a factory. And I know what I'm doing to my body. And next day I'll go on a detox to pull it out of my body. We're all human, right? We all have temptations and we must satisfy temptations. But stop eating soya milk and dairy products if you are diagnosed with gynecological disorders. That's rule number 1. Rule number 2, what can I add? First, we've removed what is causing damage. We've arrested further progression of the disease. Positive input. What are the foods I can include? Carrot, beetroot, spinach, fenugreek, ajwain, carom seeds, pomegranate, grapes. These are excellent fruits and vegetables that can help in generating new blood and cleansing your blood and purifying the blood.
Okay.
Okay, so that's rule number 2. First rule is negative, removing things that are affecting you.
Yes.
Second rule is adding things that can benefit you. Rule number 3, preventive healthcare. There are a couple of medications in Ayurveda like Saptachadi Kashayam, Sacharadi Kashayam, made with medicated herbs cooked in water, and it's extremely bitter medicine. Now they say the more the bitter the medicine, the more effective it is. And it's especially true for the uterus. Because bitter medicines or bitter taste in the Shadarasa has the ability to detoxify and lighten the tissues. It can detoxify, deworm, and lighten the tissues. Now, because of sedentary lifestyle and refined foods in our diet, or meat, or cortisol-based foods, what has happened is there are toxins, ama or poison, and heavy metals collected in the body that is currently affecting the uterus, which is causing PCOD or PCOS. So when I start having ghee and when I start having medicines like Saptachadi Kashayam, Sacharadi Kashayam, I'm allowing my body to detoxify the heavy metals that is collected in the body. So rule number 1 was remove ingredients that are affecting your body. Rule number 2 is add ingredients that can help in generating new cells. Rule number 3, take herbal medications that can help in removing the toxins collected in the uterus already.
All right. Okay.
Rule number 4 is Panchakarma and rule number 5 is yoga. Rule number 4, I'll come to it because it's fairly lengthy. Rule number 5 is yoga. There are a couple of exercises that focus on the uterus, like the butterfly exercise. If you see the shape of a butterfly, it's very similar to the shape of a woman. And nature is not a coincidence. Everything in nature is for a reason.
Definitely.
Okay? The butterfly exercise especially increases blood circulation to the uterus. the chakrasana position, the navasana position, the shirsasana position, or even the shavasana, the resting. Because women absorb a lot of negative energy and tensions and anxiety of the whole family, and they take it as a burden. And the uterus is always the first thing to get affected because your emotions are linked to your uterus. Your skin and hair is linked to your uterus. Okay. Now, the number 4, Panchakarma treatment. So there are 5 yoga exercises that you can do, which is available on YouTube. All of you can do that to help
Just
get rid of.
for the sake of all our participants, especially the younger ones, I would like you to repeat the names of, specify those exercises once again.
Okay, so I remember about 3, 4 of them. I know there are 5.
Yeah.
Of course, butterfly exercise is very important. Anything that stretches the uterus. Okay, so even Shirsasana, increasing blood circulation to the lower part of your upper part of your body, that also helps in increasing blood circulation to your uterus. If you can't do Shirsasana, take it with help, or at least put your legs up on the wall. Put your legs up on the wall with your body horizontal on the floor. That will increase blood circulation to your uterus and to the lower part of the body. Then doing chakrasana. Chakrasana is inverted position, right? Your uterus is getting stretched.
Yeah, you go down.
That also helps in exercising the tissues. Navasana position, you're strengthening your core.
Yeah.
Anything that strengthens the core strengthens the uterus. The uterus, if it's going through a sedentary lifestyle, will become loose and ineffective. Then it starts suffering.
Just before you go to Panchakarma, you know about Dr. Google. How is it with these children these days? Any issue and they just Google. And when I Google, especially facts related to certain ailments, it's mind boggling because it appears that you are yourself infected or afflicted with almost all the ailments that are there on Google. And there are certain overlapping symptoms that you always get. Now, how does a youngster who realizes that she has PCOS or PCOD, what are the first symptoms that she should be looking at and should be the warning signs for her?
Now, if you're not following the moon cycle, the 28-day cycle, if your periods are getting irregular, if it's getting delayed, or if it's getting advanced, excessive bleeding, hirsutism, which is growth around your face, excessive testosterone levels in your body, you're feeling aggressive, you're feeling PMS, you're feeling irritable, you're feeling excessive hair growth and even blackheads around this region and pimples in this part of the face, because this part of the face is directly connected to the uterus, the lower chin and the upper lip. If you keep having pimples, acne, hair growth, blackheads, even white hair, excessive secretion of oil, these are connected to your uterus. So if you notice, we get blackheads and pimples just a few days before the periods, and PMS just before a few days of the periods. It's not a myth. PMS is not a myth, it's real. So that means your skin, your hair, your moods are connected to the periods, the period cycle. So anything that goes wrong with your period cycle, immediately you go check with a gynecologist or an Ayurvedic doctor, whoever you're comfortable with, to figure out what's going on inside the body. Second, stop taking medicines to delay your periods. That's the most dangerous trend I have seen. My own staff and therapists will not practice Ayurveda because they say ghar ki murgi dal barabar. They will run to an allopath for immediate results. And they would secretly take medicines to delay their periods for a house function or a marriage or an event. And then they come and say, ma'am, I haven't got my periods. Can you give us some medication? And then when we scratch a little more, they'll confess that they took a tablet.
Okay.
Why would you mess around with the nature of your body? Your body is supposed to expel blood out every 28 days because that's its natural cycle. When you force it in, it causes vata imbalance. So that's another thing. If you're a young woman, stop taking medicines to delay your periods for an event or a function or a party and stuff like that. It messes around with your cycle.
Okay.
Birth control pills, I'm sorry to say, are unnatural. Let a man use contraceptive. A woman using birth control pills is unnatural because you're trying to control the mechanism of your uterus from outside when you are not capable of creating a uterus from scratch. You shouldn't try to control it. That's another thing. And I'll just tell you a quick joke on the Google, because you said, lots of youngsters are going to Google. Google itself is going to give a disclaimer very soon. I'm not a doctor. Okay. I'll tell you why. I had a call about a year and a half, 2 years ago. I was sitting in the clinic at 6 o'clock, we closed. At 6 o'clock, I got a frantic call from this mother saying, my daughter's, palpitating and getting crazy. And she's, having extreme negative thoughts about her life itself. And, I don't want to say the word, but can you speak to her? and she's saying that she has brain tumor. And I spoke to her, I said, okay, the 18-year-old girl, I spoke to her for 45 minutes till she calmed down. And she said, no, don't worry. I won't do anything crazy with my life. I said, thank God. Come and see me tomorrow. You take care of yourself till tomorrow. After that, I'll speak to you. Anyways, later we figured out the problem was not the child. The problem was the mother that was, forcing the child a lot into a lot of different unnecessary things, which was causing her to go through anxiety. She said she went on Google and she, looked up her symptoms, headache and this and that. And Google said she has a brain tumor. So 18-year-old girl calls up and says, I have a brain tumor. Who told you? Google told you.
Yeah.
Google will tell you have cancer, you have brain tumor, and you're not supposed to survive. Google will also tell you that, tomorrow you're supposed to die. Stop believing it. It's not a doctor. Google is just a platform. Even Google is very slow to leave a line saying that, listen, I'm not a doctor.
It's absolutely so important for us to have people like you around, because as you said, ghar ki murgi dal barabar. It's so true for this country as a whole. Ayurveda will not be acceptable to us unless and until it takes the Western route and comes to us. Yoga goes there and comes back. Ayurveda goes there, they practice and believe in it, and so we start doing it. So with people like you around, it's such a blessing for us, Dimple. And yes, you were talking about Panchakarma. So PCOS, PCOD, and Panchakarma. How does this combination?
Connected. Very powerful connection. This is, in fact, the crux of the whole conversation when it comes to gynecological health. Panchakarma can help preserve your gynecological health. And, adding to the point that everything goes to the West and then comes back to us. Like yoga went to the US and came back as Columbus yoga, and now we value it more. Ayurveda's practiced more in California than in India.
Mm-hmm.
And honestly speaking, people say, oh, you're an Ayurvedic health coach. You're the reason I got into Ayurveda, this and that. And I realize Ayurveda has been there for 5,000 years. It's not my intellectual property. All I'm doing is bridging that cultural communication and language gap so that you will believe in what Ayurveda has been saying for the last 5,000 years. It has been screaming for 5,000 years saying, please practice me. I'm the preventive curative healthcare system. Nobody wants to listen. Now, when I'm translating what he wants to say or she wants to say, Ayurveda, I don't know if it's a he or a she. Now, when I'm translating it, people are willing to listen. And I was like, wow, ghar ki murgi dal barabar. If I give advice to my father and mother, they will not take it. But if a doctor gives advice, when they pay money for it and take the advice, my dad himself says, when I pay money for it and take advice, I'll probably value it more. That's the human psyche, right? Anything comes for free, we don't want to value it. Yoga and Ayurveda is free in India, nobody values it. So anyways, coming to Panchakarma treatment, I hope, that gives a valuable lesson to value our heritage, our roots, our history, our ancestry, the things that our grandmothers and great-grandmothers and all of them have put together. That knowledge is so powerful. Don't write it off.
You've been into advertising. I'm sure you'll be able to innovate more as far as, spreading this beautiful concept is concerned with your background of advertising, innovating, how to carry it forward, making it more popular amongst the people. Yes. And yes, Panchakarma. I'm very eager to know about that.
Okay. So Panchakarma, like you said, advertising is actually one of my past, and I realized, I was wondering if I wasted my time in my career, like doing 5 things, but all the dots connect. That is helping me sell this better. So, thank God for that. Thank God for, the ability to glamorize something and sell it, because people like nail polish. They don't want plain nails. Right? So I'm just applying nail polish and Ayurveda and selling it to people. Now, Panchakarma, what is Panchakarma? Panchakarma basically means 5 karmas. Pancha, karma, actions.
Yeah.
These are the 5 actions with which I can detoxify my body.
Definitely.
Rule number 1 of Ayurveda is detoxify your body of heavy metals, toxins, viruses, parasites, and bad bacteria. Not the good bacteria, only the bad bacteria. We need good bacteria to survive. That's rule number 1 of Ayurveda, detoxification. If there is no toxin in the body, there's no room for diseases. Simple logic. What goes in has to come out. If it hasn't come out, if your input doesn't match the energy you got from it and the output, something got stuck inside the system, then we must work on it to pull it out. So there are 5 ways of cleansing the body. Out of this, at least 3 apply to the uterus itself.
Okay.
In Ayurveda, there are 8 branches. There is toxicology, there is psychology, there is pediatrics, fertility, surgery, internal medicine, and there's another vertical, ENT. Okay. And one more thing, general medicine, 8 branches of Ayurveda. fertility was a separate branch in Ayurveda by itself. They had a separate line of doctors for it. Now, Panchakarma, there is Nasyam, Vaman, Virechanam, Basti, and Raktamokshan. These are the 5 treatments. Now, Raktamokshan is bloodletting. We usually do it only for skin diseases. When there is toxins collected under the skin, we use either leech or sterilized needles to pull the toxic blood out. Raktamokshan, bloodletting. Vaman is vomiting. If there is too much toxins collected in your lungs or too much mucus or thick fluids collected here, it leads to a whole lot of bronchial diseases, pneumonia, and lung disorders. Then we use medication to vomit it out. Okay, so that's again not for gynecological disorders. The other 3 are applicable to gynecological disorders. Nasyam, introducing medicine through the nose. How can it control your uterus? A lot of people ask me that question. I was like, this is the magic of the body. You think you can isolate an organ and work on it, you're highly mistaken. You can go to a surgeon and get your gallbladder stones removed, kidney stones removed, or even your uterus removed. But did you get to the root cause of the problem that was causing the gallbladder stones, kidney stones, or the uterus-related disorder? No. Can this surgeon give you a guarantee that you'll never ever have a uterus-related disorder unless he's removed the uterus itself? Right? So you have to get to the root cause of the problem, and you have to understand the pituitary gland inside your brain is the one that controls all your organs, including the hormones in your uterus. Now, the pituitary gland is like a small little walnut in the middle of my brain, and I cannot access it easily. It's getting fluoridated due to the presence of fluoride and heavy metals and chemicals in our water. So instead of being pink in color, it's becoming white in color, and it is confusing or giving confusing messages to different organs, including the uterus, causing hormonal imbalances. Hormonal imbalances come due to the pituitary gland being affected and due to ingesting estrogen and hormones of another animal. So what do I do when I introduce medicine through the nose? Between the nose and the skull, there is a point here. There are 20 nerve fibers, which is the gateway to the brain, which is connected to the pituitary gland. So when I introduce medicine through the nose, it stimulates those 20 nerve fibers and stimulates the pituitary gland like an exercise. The pituitary gland starts releasing its toxins that it has collected. It's like an exercise, like how you have to exercise your abdomen to lose abdomen fat. You have to stimulate the pituitary gland. It also nourishes the 5 senses and removes all the sinuses collected in the sinus area, the mucus, and drains it into the throat and you spit it out. And it is also excellent for insomnia, anxiety, stress, and depression. But the most important function is it's great for your skin. It removes dark circles and freckles as a result of improving your hormonal imbalance. So Nasyam is a great treatment for anyone who's going through anything that's gynecological, PCOD, PCOS, infertility, and stuff. In our clinic, we have done infertility treatment for 3 patients in the last year. All 3 of them, including my sister who did infertility treatment in Delhi, 4 patients, have given birth to healthy babies this year without IVF and without any artificial insemination or even surrogacy. After having failed all methods, they became pregnant after cleansing the uterus. That is through a treatment called Basti, along with Virechanam. Basti is pooling of medicated oil into the colon to cleanse the colon, because the colon and uterus, I said it in my previous interview, are like neighborhood aunties who are constantly gossiping. If something is wrong in the colon will transfer the negative energy to the uterus. That means if there's waste sitting inside your colon for more than 24 hours, the uterus ends up absorbing that waste. Okay, so keeping the colon clean is step 1 of maintaining good gynecological health, because they're sitting right next to each other with a thin bag separating them. And a thin bag is extremely porous. Your skin is extremely porous. Your organs are extremely porous. They absorb toxins from each other. So Basti is pulling of oil through the colon to remove the toxins collected in there and doing a series of body massages to increase blood circulation, stimulate the toxins from all over and bring it to the gut, and then introducing medicine through the colon to pull those toxins out. There is 3 kinds of Bastis: Matra Basti, Kashaya Basti, and Uttran Basti. Matra and Kashaya Basti is medicine introduced through the colon. Matra is 100 ml of medicine, medicated oil used as a lubricant to lubricate the colon, and it's kept inside for 1 to 12 hours. The longer you keep it, the better. Then there is Anuvasana Basti, where we introduce 200 ml of the oil. Kada Basti is introducing 1 liter of medicine through the colon and flushing it out immediately. This is done on an empty stomach only. Okay. The 3rd treatment that I said, Matra, Anuvasana, Kada. 4th is Uttran Basti, introducing medicine into the uterus directly through the vagina.
Right.
Some people cannot bear the pain because it's sensitive skin, right? So when you have to inject a little bit of medicine, through a catheter, a soft rubber catheter, some people can't bear the pain. So in our clinic, we don't introduce the medicine to the uterus directly. We introduce the medicine into the colon and we cure infertility. So how is it possible that I introduced medicine into the colon, the uterus started getting better? Which means the colon and uterus are constantly contacting or reacting or communicating with each other and exchanging energy. So ensuring that you don't have constipation, you don't have colon health issues is step one to prevent gynecological disorders.
Definitely.
And there is Virechana, which is oral medication, which I told you, Saptachadi Kashayam, Saracharadi Kashayam. Then there are a whole lot of other Ayurvedic medications that we give to induce purgation and release toxins from the bowel and also to cleanse the organs. We need to constantly detoxify. So rule one for any disease is detoxification.
It's detoxification. So, two things are very clear to me. One, IVF or any other method of artificially making a woman have babies is absolutely playing against the rules of nature, whereas Ayurveda tries to bring you in alignment with natural ways and nature. Number two, Ayurveda is beyond concoctions and potions. It has specific cures for something like infertility. Now, why do I stress on the word infertility? You had those films which said that heavily loaded dialogue, ab tum maa nahi ban sakti. So when you have a woman who's been labeled as infertile, philosophically speaking, as a woman, how would you say, is she less of a Shakti? Or you would say that even though she remains infertile, she's incapable of producing children. Who is she?
You know, I'm glad you brought up that because that has so many social evils attached to it, that topic. I have seen women break down inside the clinic saying, if I don't have this child, I think my marriage is going to end. I can't bear trauma of not being able to give a child to, my in-laws and my family. She's not a machine, first of all. She's not here to fulfill your desires. She's here to exist for her own happiness. That's one. I'm 36 and I don't have children. And for me, when I was a little girl, I thought having children was the only or the best thing that a woman can experience.
Yeah.
But that's not true. I can still experience motherhood without giving birth to a child. Like, the first thing everyone asked me as soon as I came on the Zoom is, where's your niece? Because I love mothering her and smothering her with love, and I love receiving love back from her. You don't have to give birth, first of all, to be a mother. That's rule number one. Understand that. A woman is a mother the day she starts experiencing her uterus. The day you start getting your periods, you already are a mother. You're already experiencing motherhood. You're already capable of nourishing your family and another human being and even bring someone back from the dead. That's why back in the day, most midwives or doctors were women because they have a rare, nourishing quality. That's rule number one. Stop pressurizing yourself to have a child. Number two, we shouldn't judge anyone who's doing an IVF or an artificial insemination or surrogacy simply because we don't know what that woman is going through in her family, her marriage, her in-laws. Maybe having a child is going to save her marriage and save her from social, humiliation. What works for you, do it. I have seen some people have children with IVFs. I've seen some people have with Ayurveda. But I would only say, give nature a fair chance to fix your body.
Exactly.
Give nature a fair chance. We will not judge you for what your personal choices are. You do what you want to have a child. If you want to have 10 children, have 10 children. If you don't want to have children and want to adopt despite being fertile, bravo still. We shouldn't judge any woman for her choices, be it adoption or no children or 10 children or 2 children. Doesn't matter. That's her personal choice. She is the creator on this planet. So let's not abuse the creator. It's no point praying to God inside a temple when you're abusing the creator outside the temple, the woman, telling her not to enter the temple. She is the creator of the universe.
Yeah, it's a beautiful affirmation.
How can you decide she can't enter the temple? The creator can't meet the other creator. It's unfair. There's so many social evils, not just in our country. In many countries, there's so much pressure on a woman. What would be your choice? I would only say detoxify your body of physical, emotional, mental, social toxins continuously. And Ayurveda is a holistic healthcare science that understands that all diseases have a psychosomatic origin.
Yeah.
If you're not mentally happy here, you will not be able to conceive a child. Now, this Australian girl who came to us for infertility, she underwent 28 days of infertility treatment with us. And she immediately went for the IVF and it was a failure. We felt really bad for her. Maybe, we failed, or, maybe nothing was working for her. We felt really sad for her. She felt like her marriage was going to end. But the next year, she changed her mentality. She said, you know what, I'm done pressurizing myself. I'm going to enjoy my life and I'm going to enjoy my marriage, however long it lasts. And she naturally conceived, and it was a surprise even to her that she conceived. The minute you let go of the mental, emotional, social pressures, your uterus will start functioning again. That is rule number 1. Rule number 2, align it with nature. Do not consume foods that are viruddha to your body, like meat, red meat, white meat, seafood, fish and eggs, and even dairy products if you're undergoing some uterus-related disorders, because your body cannot consume the cortisol or the pain or the trauma of another mother because you want to experience motherhood. These are some basic things I say for anyone who wants to be a mother. Trust me, even I want to. And I know that when time comes, it'll come. If it doesn't come, it's fine. There's always adoption. There is always other ways. You can always mother other children and spread the love. So don't pressurize yourself. That's rule number 1. Remember your nature.
You spoke about psychology being one aspect of Ayurveda, and that just brought up all this in my head. And I thought stress and all this PCOS, PCOD, infertility, and all this leading to stress, I think it's all a vicious circle. And you've explained it so beautifully. Now, coming to another topic that we are going to talk about was urinary tract infection. It deals with hygiene of the uterus, isn't it? And what are the important points that should be stressed upon if we wish to have a very clean and healthy uterus?
Now, there was another point that I wanted to see for infertility, by the way. That's nature's way of controlling population explosion.
Yeah.
Believe me, nature created infertility through human intervention. Human intervention created the whole commercialization of milk and estrogen and everything. Along with that, nature also decided if you continue to grow and give birth at the rate at which you're going, the progeny is so, when a man and a woman comes together, it's 2 people and they give birth to 3 and 5 and 10. The tree is becoming larger and larger, and the resources on this planet is becoming diminished. So nature also created infertility in a way to control population explosion. Believe me, nature is constantly communicating with each other. When the deer population went up dramatically in one particular part of the jungle, it caused erosion of the soil because they were eating up all the grass, and it started causing a lot of flooding. When the soil gets eroded, there's flooding. So the grass and the trees communicated with each other and decided to stop growing to control the deer population. So that happens. Nature communicates. Okay, that's one. Now, urinary tract infections. How do I keep my uterus clean? First of all, don't put any product in your uterus. There are a lot of products that is available in the market for cleansing of the vagina and stuff like that. Stop putting products, because uterus is a natural self-cleansing organ. The uterus is a natural self-cleansing organ. It has a whole line of bacteria. It has a whole line of cells that takes care of itself. Okay, it's taking care of its own health, the uterus.
Okay.
That's number 1. Number 2, in fact, when we have white discharge, our grandmothers and mothers would say, stop having yogurt. And we were like, what's the connection? And it's not a coincidence. When you're having any kind of white discharge in your urine, feces, or from the uterus, from the vagina, stop having all white colored products, all dairy products, including milk, yogurt, buttermilk, paneer, cheese, even white rice for some time. Have brown rice instead. Because your body takes information from the food it eats. Food is intelligent information that you're consuming, and that information comes through colors, through texture, through density, through grossness, through lightness, heaviness, and stuff like that, through taste, right? You're consuming a lot of information. So stop having all white colored products if you notice anything coming out of it. 3, every time you go to the washroom, remember the woman's organs are open, right? When you splash water on your private areas, your uterus, your vagina, your urinal area is consuming the minerals, metals, and chemicals from the water. Correct? So always make sure you keep your private areas dry, okay? So that you don't allow it to become a breeding ground for fungal infections. A clean diet, a hygienic lifestyle, and avoiding sanitary napkins and tampons.
In fact, that's a
Maybe
question that's coming up. And the girl
it
is
can cause
asked,
cancer. It can cause cancer. Believe me, it can cause cancer. Back
so
in the day,
what's
they
a
used cloth. Of
substitute?
course, honestly, even I'm struggling to be honest with you. I discovered new sanitary napkins that's made with corn husk,
Okay.
and
So
I have
there's
sensitive
something
skin to the
as
point that I get rashes.
menstrual cups.
Menstrual cups, if you're comfortable, use it. I find it very uncomfortable and painful simply because it seems like a fairly large product for me to insert in my uterus. Like it seems like a big product. For those who've succeeded in mastering that technique, bravo. You've reduced your carbon footprint. Bravo, you've reduced your carbon footprint and you're doing a fantastic job of making sure that you're not artificially affecting your uterus, right? You're just putting a synthetic cup and you're collecting a silicone cup which doesn't have any residue. Tampons is a very bad culture, inserting something inside your uterus, because remember, it's not just blood that's coming out, it's a lot of broken muscles and mucus that's coming out, and that cannot get absorbed in the tampon, that gets stuck inside. Okay, using sanitary napkins that's artificially made, these price sensitive sanitary napkins that's come out, 8 rupees, 10 rupees, they are made with a lot of synthetic gels which are cancerous. Your skin is extremely porous, your uterus especially, your vagina especially, starts absorbing all those negative chemicals and toxins, and that can lead to a whole lot of gynecological disorders, including cancer of the uterus and the ovaries and vagina. Corn husk based sanitary napkins is becoming a rage nowadays. I love the texture, and I gauge it by the amount of rashes I get from it. I gauge it on 1 to 5, saying how many rashes I got from the sanitary napkin. 0 rashes, it's a great product. Your
Okay.
skin is constantly talking to you. So there's a lot of home care thing. You also get these cloth-based napkins now, that the washable ones, reusable ones. Even that's fine. It's soft and it's gentle on your skin.
So there was one question which really intrigued me. And the question was, do boys also suffer from PCOS or PCOD?
Not that I know of, but I know they get breast cancer.
Okay.
I know that men also get breast cancer because of it's called the slang word is movies. It's not the right word, because they also have glands and excessive accumulation of soft tissue. The breast is just soft tissue, right? It's not a bone or muscle or something. It's just soft tissues. It doesn't have a muscle of its own. The accumulation of soft tissue there can become cancerous due to wrong lifestyle, sedentary lifestyle, or wrong diet, or packaged foods, or toxins and chemicals in your food. So men are also at the risk of getting breast cancer, from what I know. Whether they get PCOD or PCOS, I don't think. They need to have ovaries first to get PCOD and PCOS. So if they don't have ovaries, it's not possible for them to get polycystic ovarian disorder.
Yeah.
If I give you an apple and I tell you this apple has a kidney stone, you won't believe it, right? You'll be like, the apple doesn't have a kidney. How will it have a kidney stone? So the same rule for men. They don't have ovaries, so they can't have diseases of the ovaries.
Perhaps I think the idea was that anything which is akin to it in their reproductive system, maybe that was the question. There's
So they have different issues.
is different
They
issue.
have erectile dysfunction. They might have prostate cancer, or issues with the organ, the genital itself. They have issues with the organ that they have. They cannot have uterus cancer because they don't have a uterus. They cannot have PCOD, PCOS because they don't have ovaries. So it's just that I think what they wanted to know is, can men have disorders of the reproductive organ? Definitely.
Now, somebody's been asking you about the benefits of having Karela juice.
Very nice. Karela juice is part of our Indian culture for a reason. In fact, if you don't want to have Karela juice, having Karela sabji even once a month can help in detoxifying, deworming, and lightening the tissues. Karela is bitter food, right? Now, sweet foods nourishes the tissues. Sour food cleanses the tissues. Like, nimbu is sour. When you have a greasy dish, you put some lemon to cleanse the dish. Similarly, in your body, sweet food builds the tissues, sour food cleanses the tissues, salty food lubricates the tissues, bitter food detoxifies, deworms, and lightens the tissues of toxins. Astringent food tightens the tissues because of its water absorption quality. And then there is pungent food, which basically stimulates your digestion and your tissues to be alive with blood circulation. So having Karela and bitter foods in your diet, like palak, spinach, or even little bit of coffee once in a while, fenugreek, fresh methi, as well as the dried fenugreek seeds in your diet, Ajwain, carom seeds is also bitter. These are excellent for your uterus health. And then I give you a series of other vegetables like carrot and beetroot and fruits like pomegranate and grapes. They're also very good.
Okay, definitely. I think people do relate bitterness and bitter tastes with something which is very beneficial. So I've seen people chewing the neem leaves in the morning. What role does
Yes.
neem have in this entire concept of Ayurveda, the science?
Oh, neem is very, very, very powerful. It's, I think, the most powerful herb that nature has given us. In fact, in Ayurveda, in our clinic, we have a bed made from a neem tree. The table was carved out of a single tree and there is no joint or gum. And I know that because I've taken that tree from Mother Nature, I must return back the tree by planting 10 to 100 saplings, right? We pray to it. When we have periods, we don't touch that tree. We don't touch that bed. Not because we are impure, because the neem bed is extremely heaty and you're already going through heat related bleeding. You know, pitta goes up in your uterus and you're able to bleed. It's not because you're impure that you're asked not to touch the neem. Neem is so powerful. It's anti-inflammatory, antibacterial, antiviral, antifungal. It kills all kinds of bacteria and virus inside your body. And it's so powerful. If you overuse it, it has an anti-spermicidal effect. It can reduce sperm count of a man if you overabuse it because it's so powerful and potent. And for a woman, it can cause miscarriage.
All right.
A pregnant woman should not consume neem under any circumstance unless being administered by a Vaidya for a very serious disease. Only in that case, they probably given neem because neem was used back in the day to cause abortions. So
Okay.
be careful when consuming neem. But what are we using neem for? The bitterness of the medicine kills all kinds of bacteria and virus. The coronavirus attacks the sweetness of your blood by making your blood bitter, by making your bronchial health bitter and stronger, devoid of mucus. You are avoiding any breeding ground for the coronavirus.
Okay.
So even if you come into contact with the virus, because of the bitterness already in your blood and in your bronchial health, you're able to kill the virus. So neem helps boost your immunity against this virus.
Okay. So how many leaves would you recommend maybe at a time during the day?
So I recommend taking it only for 15 days, taking a break, and then again starting it. Don't take it more than 15 days. It's very heaty, right? It's so powerful. It's so powerful that too much of good is also bad. It's going to cause emaciation of your organs. Just take 5 grams, not even 5 grams, 5 milligrams, like a handful of it. Just a handful of neem leaves based on your body size. Your palm knows what is the measurement of food for you. Wash it nicely first because remember, there's a lot of pollution on the surface of the leaves. Wash it nicely either with lemon or baking soda water or whatever you like. And then put it in a mortar and pestle. Don't put water. Put it in a mortar pestle and grind it nicely and make a fine paste out of it.
Okay.
Put the paste at the back of your tongue and swallow it. Do not have water because the bitterness will spread in your mouth, followed with either jaggery, sugar, or honey.
Okay.
Okay, so neem should be taken empty stomach in the morning, and for 1 hour after having that medicine, do not have food or water. Give it 1 hour to kill all the bacteria and virus in your body. Especially, it helps in purifying the blood. So we give it to teenagers because the bitterness of that neem helps in purifying the blood and prevents acne, pimples, rosacea, eczema, psoriasis, urticaria, and everything. And in our clinic, when we have a patient with skin disease, we make them sleep on the neem table. And we pour medicated oil on the table, which reacts with the neem of the table and with the oil and with the skin and helps in healing that person. And it is self-cleansing. Neem is self-cleansing. So that table, we don't wash it with water. We have to clean it with oil. So neem is that powerful when it comes to cleansing and purifying your blood and your body.
So, in fact, you've relieved many, many people, especially anxious mothers. So, the recipe, the concoction is very simple. It's a handful, a fistful of neem leaves, gulp it down, wash them properly, chew them, gulp them down. And if it's too bitter, which it will be, take some jaggery or honey. That boosts your immunity system. Isn't that so?
For sure. For sure. But chewing can be a little challenging because it's so bitter. So what do? Make a paste out of it, like in the mortar and pestle, like a goli,
Grind.
and just put it at the back of your tongue and swallow. Like when COVID-19 started, our clinic was still functional in the beginning, in the beginning of March.
Yeah.
It was mandatory for all my staff, all my team was women. It was mandatory for all of us, including me, to consume neem in front of each other as an evidence that we took neem. And they would actually chase me saying, ma'am, I didn't see you take neem. They'd come with a bowl and with some mystery. And like a child, I'd put the neem in my mouth and quickly swallowed and put mystery. So, my staff would also chase me for the neem. We made it mandatory for all my staff, and touch wood, I'm telling you, nobody in my inner circle, my 2000, touch wood, the 2000 patients that we have and the students we have, nobody in our inner circle has contracted the virus because we sent them the immunity boosters tip and information as soon as the virus broke out. In March, first week itself, we started sending out information. Neem, Philanthus neruri, which is Bui Amla Kapatta, Amla, Chavanprash, Guduchi, Brahmi, colloidal silver, ginger. We started sending out all these tips. And by God's grace, nobody in our inner circle has got it yet.
Oh, how wonderful. And there's another question that has come up, Dimple. Any concoction we can make at home to get the periods on time? And she also wants to know about a colon cleansing method.
So don't make any concoction at home. That's rule number one. Just make sure you're cooking your food with enough fenugreek and ajwain. These are the two herbs or spices that I recommend in cooking your diet to regulate your uterus health. And having carrot spinach soup for a few days can also help. Some people have a glass of papaya juice to induce their periods early. Now that's very heaty and it might make you sick for a day. But instead of having a whole glass of papaya juice, why don't you just have a bowl of papaya fruits? Any heaty fruits, any fruit that can cause heat in your body or vegetable that can increase your heat can help you get your periods on time. That's one. Simple things that you can do at home. Papaya, pineapple, then fenugreek, ajwain, spinach, even coffee. These can help in regularizing the periods. But beyond that, I suggest you meet an Ayurvedic doctor. She will give you these kashayams that I mentioned, Saptachari Kashayam and Sacharadi Kashayam. Like I told you, my staff themselves took medicines to delay their periods for a wedding, and they came to me to fix it. Within 15 days of the medication, she just finished half a bottle, her periods became regularized. So definitely meet the doctor. And for colon cleanse, like I said, the Panchakarma treatment is done by a seasoned Ayurvedic practitioner and therapist. It requires introducing medicine through the colon, but before that, you must go through the diagnosis, which is the Nadi Pariksha. After the Nadi Pariksha, they'll give you 15 days of medications and lifestyle change or dietary change. You must also undergo that. And after that, you will also have to undergo massages to first increase blood circulation, collect the toxins from around your body and bring it to the gut, right? You have to stimulate the toxins. It's collected everywhere. It's collected in your fingers, in your toes, in your nose, in your ears, in your head. You have to stimulate it and bring it to the gut. Then you introduce medicine into the colon to pull the toxins out. So it's called Panchakarma. You can do it for 3 days, 5 days, 8 days. It's usually done in multiples of 7, 14, 21, 28. One additional day to stop the process.
Okay. So while we draw this session to a conclusion, would bother you a little bit and just say, please summarize for us your do's and don'ts once again for a very healthy gynecological system.
Okay, to sum it up in maybe 8 to 10 easy tips. Rule number 1, be happy, be devoid of stress, because you're a woman and your uterus is the source of the universe. Don't forget, you are the source of the universe. The universe was born out of you and you're the creator. The minute you understand how empowered you are, also realize not to put stress on your uterus to give birth or to not give birth. Doesn't matter. If you've conceived naturally and if you're pregnant, don't go and do a miscarriage just because you're not ready to have a baby despite being married or something of that sort. Don't do that. It's unfair to kill a child. Please have the child. The child is a God's gift to you, right? Or nature's gift to you. So be happy. Stop stressing yourself. Be aligned to nature. Don't do anything that is against nature because you are directly connected to nature. Be it the way you eat, the way you drink, the way you sleep, or the way you react or enter into a relationship. Everything has to be natural. Anything forced or artificial is going to lead to disorders. Number 4, if you've already unfortunately got symptoms of PCOD, PCOS and stuff like that, stop taking all dairy products, including eggs. This is something I'm missing. Eggs is what? Estrogen of the chicken. You're not able to consume or digest the estrogen of your own body, so don't consume the estrogen of a chicken. So stop all dairy products, eggs and non-veg and fish if you can. Okay. Number 5, change your lifestyle. Start engaging in yoga, pranayam early in the morning, at least for 40 minutes to exercise your uterus because your uterus is now sluggish and sedentary lifestyle has ruined it. It is loaded with toxins. Start flushing the toxins out. Number 6, meet an Ayurvedic doctor, get some medication just for 15 days because you've damaged the body. You need to reverse it faster. Food cannot help you so much as medicines can. In food, of course, the whole series of foods that I told you, like carrot, beetroot, spinach, pomegranate, and all of that. Over and above all of this, stay positive. That's the most important thing for gynecological health or any health disorders, because hope, faith, and positivity can change the course of a river. Destiny and fate is nothing. So don't say it's destiny that you're suffering or it's fate that you're, infertile or fertile or, suffering. It's not destiny and fate. Hope is the only solution for all issues. Keep hope.
I don't know why, but as I listen to you, the phrase that comes to my mind is this amazing process of inner scrubbing that you're talking about. Ayurveda is so much more than simply medications. It's holistic, it's inner scrubbing, it's something to do with your mind. It's completely spiritual and philosophical at one level. How beautiful. Now, it was such a beautiful note where we could have, just wanted to go on and on. But would you mind taking a couple of more questions?
Sure, why not? Why not?
Yeah.
And, I wanted to add one sentence to what you just said. It's a very powerful thing that you said, inner scrubbing. Remember, Ayurveda and yoga is not the means to an end or the ends to a means. Ayurveda and yoga are the two tools you use to prepare your body for meditation and thus attain salvation.
Okay.
So it's not the end of your world. It's a very spiritual, philosophical process, Ayurveda and yoga. A lot of people end up getting spiritual ego after becoming an Ayurvedic doctor or a yoga teacher, and they think they've accomplished it all. No, that was just the first step to prepare your body for meditation and to attain salvation. So remember, the pyramid is salvation at the top.
Yeah. So there's Kavita Mukesh. She says, ma'am, water is more important. So tell us how to have water, the different ways. Filtered water, is it good to consume? Filtered water, RO water, Bisler, bottled water. People are confused. It's a good question.
Okay, so the first rule of water is anything with human intervention is going to ruin it. So just to transport water from a river to the cities, we put pipelines and we, coated it with chlorine and fluoride and all sorts of stuff, which has, first of all, ruined our health. Then we have started creating water filters. First, we are scrubbing our body of natural oils and then we're pushing artificial oils into our skin. It doesn't make sense. First, you're putting chemicals into the water, then you're creating a water filter to remove the chemicals out of the water. That also doesn't make sense. Okay, all these water purifiers that's come out, like Kangen and whatnot, which promises to, prevent cancer. I have my own inhibitions towards it, simply because human intervention has never led to good health. Alignment to nature is better. So when it comes to water, you first filter it of all kinds of residues, sediments, and heavy metals or minerals that is visible using a muslin cloth. These are age-old techniques. You first filter it using muslin cloth, and when you boil water, it kills all kinds of bacteria, virus, parasites there is, and the heavy metals get, settle at the bottom of the bowl again, if there is any. Again, you filter it and you store water in a mud pot. Mud water alkalizes your stomach, and cancer cannot exist in an environment that's alkaline.
All right. And so how long do we boil it?
Till you start seeing the bubbles.
Till you start.
Once you start seeing the bubbles, that means the water is fully boiled.
So it's not 10 minutes after the bubbles. It's just the moment they start coming up on the surface that you stop.
That's enough. After that, you're just contributing to the evaporation of water and creating new clouds.
Okay. Lot of compliments coming your way. Many of them want to see more of you, talk to you, consult you. And somebody says, so beautiful. It's been a beautiful experience. Another person says, she's superb. God bless her. So you're carrying with you a lot of blessings. And I can see that you're so young, much younger than I am. And I can only wish you well, say God bless you. May you be the modern age Dhanvantari, and the spiritual evolution that you're talking about. May you attain that. May your journey be enriching to yourself as well as to others. Thank you so much, Dimple. It's been
That was so
pleasure.
kind. I have to tell you, like, these are the kindest words I've heard all day, besides the words I heard from my niece, because children are incapable of saying anything mean, right? Your words have made up my day. And quite often, when I was marketing Ayurveda, I tell you this, I was standing at the farmers market every Sunday distributing pamphlets. Despite being an accomplished banker, I had to put my ego, swallow my pride, and stand there at the market and distribute pamphlets. And there were times where I was, said mean things by educated people saying, you are marketing something that doesn't have any value or research or validation. And, it's not. And there was a time I broke down into tears in the middle of the market to the doll, Kavita Mukhi, saying that I can't do this. I'm marketing Ayurveda for the benefit of people and I'm getting abused and, backlash. But every time something discouraging happens, I tell myself that this is my purpose in life and this is God's work that we all have to do on earth, which is preserving the nature, the planet, the ancient wisdom and senses for our future generation. This is a little pain that we all go through to preserve for the future generation. And the words that you've said, I tell you, is far more gratifying than any financial success I might have seen in my past careers.
It's
So
straight
I'm
from
really
the heart,
grateful for the
Dimple.
words you've said.
It's straight from the heart, Dimple. And I think I'm only voicing the feelings of so many people who must have come in touch with you, who are listening to you right now. And God bless you. Thank you so much for being here. I think we'll meet again and again because there'll be many issues coming up in our heads. The one that's coming right at the moment in mine is, what about women facing premenopausal issues and those who had a menopause? What does Ayurveda offer to them? So maybe one of these days, if you find time and if our stars are aligned the right way, we'll be back again with you. Thank you so much. I'd just say, tum jiyo
Thank you so
hazaron
much.
saal. Thank you.
So sweet, so sweet. I'm very grateful for the words and thank you, Neha, and thank you, Ms. Shubha and Sujata and the whole team of Pavitra Connect for doing such a wonderful job of spreading this knowledge and creating such a divine platform. Lot of gratitude to all of you.
Yes, and a big thank you always to Pavitra for making our day so special, so Pavitra, so pure, so purposeful. We'll be back again very soon. Thank you, Pavitra. Thank you, Dimple. And thanks to all the participants without whom this would not be possible. Bye.